Your thoracic spine, so your mid and upper back, is supposed to rotate freely to have smooth and effortless movements whenever we are running or we're walking. But because a lot of people live in an extended position where we have the rib cage pushed forward and we have a greater arch in our back, we hold ourselves back from having optimal rotation. Because you can try it for yourself. If you are in an extended position where you push your rib cage forward and you now try to rotate as much as possible, you can't really go that far. But if you then pull the rib cage back a little bit and are in a little bit of a rounded position in your upper back, and you then try to rotate, you can rotate more freely again. So what we want to do now is we want to open up space in the back side of your rib cage so that the rib cage can be pulled back again. And then from there, we want to work on the rotation in your thoracic spine. Grab your stick and let's get on all fours, where we hold the stick with the palms facing up and our elbows are on the floor. We now push the stick together slightly and push our elbows and forearms into the floor as much as possible so we feel that our shoulder blades move apart. We want to tuck our pelvis under so that we round our back as much as possible. In this position now, we breathe in through our nose, directing the air into the space between our shoulder blades, chin to our chest, and we then sigh the air out through our mouth slowly and fully while we stay in a rounded position on our back. Then breathe in through your nose again and sigh the air out through your mouth. Always pushing our elbows into the floor and keeping a rounded back. Go for 5 to 7 deep breaths, and we then hold the stick behind our back and we hips back slightly and have our upper body facing down while we make sure we're not too extended, but we actually round our back slightly. And from here, we want to rotate from side to side, making sure that lower arm is pushing down a little bit so that we can get even further into the rotation on the other side. Again, on the other side, go as far as you can, always making sure you're not pushing the rib cage forward too much. And then go for 10 reps to each side.